Hi, this is Nicole. Did you know that Botox can be a treatment of chronic migraines?
Hi, this is Dr. Jonathan Youssef, Networking for Your Optimal Health. Today's topic is going to be about migraines, and joining me is Nicole from South University. She's a PA student who wants to talk about migraines and has a little bit of experience having done a rotation recently with a neurosurgeon and has some experiences with migraines and would like to talk about the differences between tension headaches, migraines, and cluster headaches. So, without further ado, here's Nicole.
So we have a tension headache, which is usually a band-like pressure around your head. We have cluster headaches that are usually unilateral, and on that same side, you'll have associated eye pain and some nasal drainage and some runny nose. And then a migraine usually will have preceding auras where you'll kind of have some visual changes. It's usually unilateral, and it will be kind of a stabbing pain with associated photophobia, nausea, and vomiting.
So do you have anybody who has a mixed picture where they may have tension headaches and then develop migraines, or something triggers their migraine, like a neck pain or maybe lack of sleep or things like that? How do you distinguish between what might be a classic headache or a migraine?
A migraine, usually it's going to severely inhibit your daily life, where you feel like you just need to be in a dark room, you're very nauseous, you're going to vomit, you can't concentrate, you can't even think straight. And it's very different because with a tension or cluster headache, you might still be able to go about your daily life and your activity.
Does it happen on one side or both sides when it comes to migraines?
I think it's sometimes different for everybody. Usually it will present on one side of your head, though, very stabbing. And also kind of all these different headaches can be kind of mixed together, and you could have all symptoms of each different type of headache.
Yes, I heard that like sometimes people would describe their tension headache to be like a band around their head. Sometimes I've noticed cervical neck pain or like pain in the base of their skull where their occiput is, where the muscles attach, and I tend to see a lot of tension headaches present that way. They usually seem bilateral. I've even seen it where the tension headaches are brought on by lack of sleep or having possibly caffeine withdrawal or maybe drinking too much coffee. So those are things I see very common, the post headaches from drinking late at night and so on. But the migraines seem to be very distinct. They are usually unilateral. They tend to bring on with aura, so like a sensation you're going to have a headache, and that can be like flashing lights or nausea. Some people have just a fullness or a sensation they're going to have a migraine. So that's how I've seen most of my patients present with migraines. And oftentimes they have it when they're young, and that kind of follows them as they get older. But in other cases, I've seen it be triggered by other things like pregnancies and hormonal changes or dietary changes, things like that also kind of are a factor. But what about cluster headaches? That seems a very unique kind of a headache. Is that mostly in men or women, or? So typically what I've seen is that cluster headaches are in men. Sometimes that's one of the sort of hallmark findings where a headache doesn't seem to go away. It may last longer than a migraine, but it's kind of presenting like a migraine where it's still unilateral. So that's one of the hallmarks of having a cluster headache. And that we need to distinguish because there are alternative treatments for that. So there may be blood pressure medications like calcium channel blockers that could be used in that case. We can use chronic, long-term medication, preventative medication we can use for that as well. So what are some of the treatments that you recommend for, let's maybe start with a tension headache?
Yes, tension headaches are the most common type of headaches that we see in our office here. Those are more like the band-like sensation around your head with severe pressure. They usually don't have the preceding aura like a migraine does. And with tension headaches, it's very important to kind of find out what the cause is. The most common cause of a tension headache is usually stress. I think it's important to look at the underlying cause of all of these headaches. it's important for a patient to come in and bring a diary of, say, the last week of when they started these headaches. We can see if it's associated and triggered by a smell, any fluorescent lighting, stress that they might be having in their life, certain foods, such as red wine can have a lot of histamines and tyramines that can cause people to have a lot of headaches. Cheese is the same way. Sometimes a lot of caffeine in coffee can trigger headaches. So I think it's important to look at these diaries of patients to see what's going on in their life. A headache can be caused by some cervical tension, and Dr. Youssef does these awesome cranial sacral manipulations to relieve the occipital nerve impingements.
As you can tell, there are a lot of causes for migraines, and some of the treatment plans are dependent on what the cause is. Having a diary and logging what triggers your migraines or headaches can be very important in figuring out what we can do to help. So the next topic is going to be basically about looking at vitamin supplementation and a little bit more in depth on our treatment plan.
Also, there can be a deficit in the patient's diet, so we can run a full panel to look at vitamins that they might be deficient in, such as B12, riboflavin, magnesium is also an important trigger. So then after we kind of look at those levels, we can recommend B12 injections and supplementation with Mitocor multivitamin that we sell here in the office. And then, of course, if we figure out that it's not triggered by a vitamin, we can always do the cranial sacral manipulations as well. If we feel that we need to start preventative medications, there's certain classes of medications that we prescribe. We could prescribe Topamax is a really big popular one that we like to prescribe. Ergots, triptans. You can also use anticonvulsants. SSRIs and TCAs are also used. The patient will take those daily. We'll monitor if the migraines or headaches are decreasing in length and frequency. And of course, if the patient goes through all of these different classes of medications with no relief, there is also Botox injections, and this is the first FDA-approved preventative treatment for chronic migraines. In order to qualify for this, you have to have gone through all of those classes of medications with failure, and you have to have at least 15 headache days per month. 8 of those headache days need to be associated with a migraine and lasting greater than 4 hours per migraine. If you qualify for this, you come into our office every 12 weeks. You get 1,000 units of Botox. It's in 31 injections. That is in your upper forehead, your temple area, your posterior head, and then also your shoulders. Basically what this does is that it paralyzes and relaxes some of these muscles so you don't have a continuous contraction that could be stimulating and triggering your migraines.
Yeah, no, excellent. I really think that a lot of what you had said really applies to many of our patients, and even during your rotation here, you've seen many patients go through those steps where they tried the natural, they tried the supplementation, and then went to the medication, and even 1 or 2 cases recently we've done some Botox for. So we've had good success with that regimen. One of the things you mentioned was the class of medications. So there was Topamax, and then you mentioned TCAs, which are tricyclic antidepressants. These are older medications we used to use for depression, but have found that they're very helpful in prevention of migraine. So they're using a different, older system of even though it's an antidepressant, it works on the neurotransmitters and the neuropathic transmitters in the brain to help. And also to go back, that there are also these anticonvulsant medications that also work similarly. We don't know how they work, but they do help to stabilize that threshold for migraine. So a simple trigger, like let's say you don't get enough sleep, or maybe you ate something with a lot of salt or MSG, it tends to increase your threshold for a migraine. Using these anticonvulsants or medications to prevent it will lower that threshold, so you're not getting a migraine so easily. And that kind of leads us to using something like cranial sacral techniques or osteopathic manipulative treatments. I use the cranial sacral technique. I use a CV4 technique, which is essentially I place my hand in the back of the neck region, right down at the occiput, which is the base of your skull, and using the cranial rhythmic impulses, I can feel when there's fullness and fluidity of the cranial rhythm. And that actually has shown to be, at least for my office, my patients have seen improvements and less migraines during their treatment plan. I also will manipulate the cervical spine using osteopathic techniques such as soft tissue or myofascial, where essentially it's like a mild massage to the cervical spine with some articulations where, that's where you feel that pop or that release of tension in your neck. So that also can help, especially done in the correct way and in a consistent fashion. And I just wanted to ask if there's any experiences that you've had with migraines or headaches recently.
Yes, so I started chronic migraines at the beginning of my didactic year of school. I think it was probably my migraines are triggered by stress or fluorescent lighting. And of course, a lot of schools have the fluorescent lighting. A lot of doctors' offices where I'm working during my rotations have fluorescent lighting. So when I came to Dr. Yusuf's office, I was a chronic Excedrin and ibuprofen user. And of course, that is pretty harsh on your stomach.
May I also add that sometimes those could cause rebound headaches if you use them too frequently as well.
Right. So I was probably using Excedrin at least 5 days a week for my headaches. And they would take them away. However, that's not healthy for me in the long term. So Dr. Yusuf recommended that I start B12 injections as well as the Mitocore multivitamin that he sells at the front desk. And he also started doing craniosacral manipulation because my migraines start in the back of my head and kind of radiate up to my temples, and it's always on my left side. So we think it might be related to occipital neuralgia, where my occipital nerve is impinged, kind of triggering that pain in my head. I have seen a significant decrease in my symptoms of migraines. I probably use Excedrin only once a week now. And so I think it's important for people to really investigate the natural way to cure headaches and migraines versus always just taking an over-the-counter pain reliever, because those can have some side effects and they can be toxic on your stomach, your liver, and your kidneys. So it's important to investigate some all-natural ways.
No, thank you for sharing that with us. I think it's a lot of people are dealing with migraines or headaches and they're just suffering with them or trying things over the counter and not realizing what alternatives they have. And so this is kind of a thank you for sharing that with us as well. Is there any other thoughts or final remarks regarding migraines?
If you do suffer from chronic migraines, I hope you do seek care from Dr. Yusuf. It's definitely important to see an osteopathic doctor because they do look at your whole picture and like to get the root cause of what's causing your ailments. So I think it's really great that he investigates all natural ways so you can start using vitamins. And vitamins also have a benefit on other parts of your health as well.
That was so excellent. That was very informative, and we are very happy that you came and talked to us about this, and we're looking forward to maybe another podcast in the future. Thank you for coming.
You're welcome.